Hello students, today we are going to look into a very important aspect, that is population explosion. Now you know that India has a very huge population size, and this population is increasing day by day. So we need to do something in order to control the size of the population. There are a few aspects which we can look into in order to reduce the size of the population or to avoid unplanned pregnancy. We call them under a popular head as birth control measures. Now you see here we have listed some of the birth control measures. They are grouped as the natural method, the barrier method, the intrauterine devices, the chemical methods, and the surgical methods. So let us look at them one by one. Now, if we talk about the natural method, now you know that in the menstrual cycle, the ovulation takes place on the mid of the menstrual cycle, that is on the 14th day. And that egg remains in the fallopian tube viable for say some 72 hours. If the sperm do not meet the egg in the fallopian tube at that point of time, there will be no conception. So, if the sexual intercourse or the coitus does not take place between the 10th to the 15th day of the menstrual cycle, then there will be no pregnancy. And therefore, we call it a natural method because it's naturally done. There is no use of any chemical or any devices to stop pregnancy. Simple that the partners, sexual partners, do not coitus between day 10 to day 15 of the menstrual cycle. And we call it periodical abstinence, that period between day 10, day 15, periodical abstinence, abstaining from sex during that particular period. The next one is called coitus interruptus. I mentioned if the sperm do not meet the egg, then there will be no conception. So say the sexual partners do have sexual intercourse, but the male partner withdraws the penis just before ejaculation from the vagina of the female. Then there will be no conceptions because there is no set of or ejaculate of the sperms into the female reproductive tract. So we call it coitus interruptus. The next one is lactation abnorrhea. Lactations with a period of giving milk for the newborn. Abnorrhea is not having menses. So lactation abnorrhea is that period when the female is completely breastfeeding the newborn child, and if there is any sexual relationship between the sexual partners, obviously there will be no fertilization because there will be no release of egg at that period of time. So we call it lactation abnorrhea. So you see there are three methods under natural method, and since no medicine or any other devices are used, this is very, very safe. No side effects. However, the chances of their failure is maximum. The next one we come as barrier method. Now there is a barrier. We are putting a barrier between the ova and the sperm. Now this barrier method can be used both by the male and the female partner. It is in the form of condoms or diaphragms, cervical caps, bolts. Now in case of the male partner, if they use the condom over the penis and have sexual relationship, obviously the sperms will be collected in the condom and it will not be discharged in the female reproductive tract, and hence there will be no chance of fertilization. Similarly, the diaphragms are used as barriers by females, which are put in the vagina or in the cervical tract of the female. Moving one, which is exclusively for the female partner, is the intrauterine devices commonly known as IUDs. Now what is that? So the uterus is the place where implantation takes place. Now suppose a T-shaped copper is placed in the uterus, then the uterus will have some irritation and there will be a lot of mucus secretion. So if they introduce the copper Ts or copper 7 or multi-load 375, these are all copper releasing IUDs, they suppress sperm motility. And if the sperms do not move and reach the fallopian tube, there will be no fertilization. Similarly, there is a hormone releasing IUD as well. The difference between the copper releasing IUDs and the hormone releasing IUDs is that the copper releasing IUD suppresses sperm motility, whereas the hormone releasing IUDs, in addition to the suppression of the sperm motility, makes the uterus unsuitable for implantation. So obviously, even if fertilization has taken place, there will be no implantation and the period of gestation won't be there and pregnancy will not be ensured. The other method is called the chemical method. We can see that they are in the forms of pills. Now these pills are taken by females. Now in order to ovulate, we have seen during the video that we prepared on the menstrual cycle, the role of estrogen, the role of progesterone. You see that when the progesterone level is pretty high, then the ovary do not release any egg. No ovulation takes place. So the pills, they are taken either orally, because they are combinations of estrogen and progesterone, or they can be injected into the female body to raise the level of the progesterone, or they can be put under the skin as implants. All of them are increasing the amount of progesterone level in the body, and therefore there will be no ovulation. And since there will be no ovulation, even if the sperm reaches the fallopian tube, there will be no chance of fertilization, hence no pregnancy. The last one is sterilization. Now this method is the terminal method. You cannot revert it generally. So in this sterilization, what do? The qualified doctor will either do it for the males or the females. It can be done for either of the sexes, either of the sexual partners. In case of males, you know that the human reproductive system, there is the vas deferens. So this vas deferens is cut and ligated. So the path for the traveling of the sperm is blocked. Hence, the sperms will not be released with the ejaculate. Therefore, there will be no fertilization. So vasectomy is done for the male partner. However, in the female partner, the two fallopian tubes that are coming from the two directions to the uterus are cut and ligated. So again, what will happen? The ovaries that release the ova will not be carried to the fallopian tube, and hence there will be no pregnancy. Now we see that there are various methods for preventing or controlling the population size. Though methods are many, but one thing we have to remember, they are against nature. Hence, anything that we use against nature will have certain side effects. So there can be nausea. Use of these contraceptive devices may create nausea. It may result into abdominal pain. It may also result into breakthrough bleeding. It may also cause irregular menstrual cycles, and it may also result into breast cancer. The chances are less, but we cannot rule out that the use of these contraceptives are harmful as well. It is therefore advisable that apart from using the chemical methods, the intrauterine devices and the others, the best way to prevent an unplanned pregnancy is natural method. That is, we have already listed the periodical abstinence, the coitus interruptus, the lactation amenorrhea, and if one follows these methods, I think we will be able to size the family, and as a result, we will be able to control the population to a greater extent. Thank you very much.